All children need love, encouragement, and support. And for kids with learning disabilities, such positive reinforcement can help ensure that they emerge with a strong sense of self worth, confidence, and determination to keep going even when things are tough. In searching for ways to help children with learning disabilities, remember that you are looking for ways to help them to learn, to help themselves. Your job as a parent is not to cure the learning disabilities, but to give your child the social, emotional tools they need to work through challenges. In the long run, facing and overcoming a challenge such as a learning disability can help your child grow stronger and more resilient. Always remember that the way you behave and respond to challenges has a big impact on your child. A good attitude won't solve the problems associated with learning disabilities, but it can give your child hope and confidence that things can improve and they will eventually succeed. They will succeed. Hi, everyone. Our topic for today is understanding special education needs, child and disabilities. And we have a very special, I am Sanjida Bhuiyan Haque, founder of Pratiddhani Foundation. And we have a very special guest with us from UK. Uh, she is Dr. Shungu Hilda. Is that right, Hilda?
Dr. Shungu Hilda
Shungu
M'gadzah.
Hilda, yes, psychologist and diversity and inclusion consultant. Hi, so you can talk a little bit about you. I've already given you your introduction. So how you started your work, where are you working actually right now?
Okay, so yes, I'm an educational psychologist by training. I trained, oh my goodness, about 30 years ago. Um, and I've been working within the kind of the psychology field since then. Um, when I trained at the time in the United Kingdom, you needed to become a teacher before entering the profession of educational psychology. So I did my teacher training, and then
Okay.
I taught for 2 years, and then I did my master's in educational psychology. I've
Okay.
also since then completed my doctorate in educational psychology, and my area of study was on emotional intelligence. Um,
Okay.
yeah, so I've been working. I do a number of things currently. I work, for different local authorities, carrying out assessments for children with special needs. I also do a lot of work within the diversity and inclusion
Hmm.
space, and I run my own private practice, and carry out different projects,
Okay.
through that.
Okay. That's
Yeah.
nice. That's nice. That's great. Okay. So I'll ask you the first question. We would like to actually do go with the basic first. So, what do you mean by special education?
Yeah, I mean, special educational needs are really kind of used to describe, children who are experiencing difficulties with learning and have
Hmm.
got, disabilities. So we're really looking at two key areas. We're looking at either children who've got learning difficulties or children who've got some form of, disability, and that can either be a mental disability or a
Right.
physical disability. The definitions differ depending on which country you're in.
Hmm.
And I've been, reading up in terms of kind of Pakistan and trying to get an understanding of kind of, what your current policies are. And I can say a little
Right.
bit about that when we come to it. But it's
Okay.
really important that, different countries have, kind of, legislation and processes which ensure that children with special educational needs are identified early. Because it's only by identifying the children's needs early that we can
Hmm.
actually put in place the provision we need to support them, to support them with their needs, so we can remove the barriers to those difficulties.
Okay. Okay.
And sorry, and the
Uh,
other thing is that, I understand that in Pakistan currently, the government is looking at special
mhm.
education policy, and they're
Yes.
actually
Yes.
in the process of moving towards a more inclusive education. So they're
Yeah.
really kind of looking to see how they can bring things up to
Yes. Yes. Yes.
the right kind of
Same.
level for those children.
Same in our countries. Actually, they're actually working with a lot of social organization plus people who are coming up with a special needs child, and they're doing conferences, a lot of things. Actually, there's a lot of conferences going on, talk shows going on, and people are actually encouraging a lot of advanced way of studying, advanced
Yeah,
way of doing it, you know, even in our country. So
yeah,
my
that's
next question will be, who are the learners with special education needs actually?
yeah. I mean, the learners, cover, there's a wide group, different groups of learners really, and
Mm,
it very much depends on, on the kind of the areas we're looking at. So in the UK, the definitions for special needs is that, you're looking at children who've got significantly greater difficulties in learning than most of the children of their age.
mhm.
And so you're talking about children who are either experiencing difficulties with learning, or you're
Okay.
talking about children who've got some kind of disability, which makes it difficult to access the learning environment. Um, and so, when we're talking about, the group of learners, we're looking at children with learning difficulties, and that can include things like reading and writing difficulties,
Mhm,
or
mhm.
difficulties in concentrating and focusing, or children who have kind of difficulties with comprehension and retaining information. So sometimes they'll have memory problems and recall.
Okay.
Another group is really kind of children who've got, I've mentioned children with physical and developmental disabilities. So,
Mhm.
within that, you're talking about children, who've got things like Down syndrome or autism, autistic spectrum
Mhm.
disorder.
Yes, yes,
Yeah.
yes.
Or children who've got, kind of another group is social, emotional, and mental health needs. Um, and also children who've got communication difficulties, and have kind of things like speech and language difficulties, and find it very difficult
Yes,
to communicate verbally. So there's a
yes.
there's a really kind of wide group of children. We're not just talking about one type of need. We're talking about a whole range of different needs.
Yeah, that is true. That is true. Okay. So my next question, we haven't got any questions from the viewers, so I'll go on with my
Yeah.
questions. What are four types of SEN and categories of disability?
Yeah, again, that it depends on which country you're in. And again, I've been trying to work out what happens in Pakistan, because I think it's
Yes.
very different to, it's quite different from the UK. So currently in the United Kingdom, we have four types of special educational needs, four main types. And that's kind
Hmm.
of communication and interaction difficulties. We've got cognition and learning difficulties. So it's the child's
Yes.
ability to learn
Yeah.
and to understand. We've got social, mental, and emotional health needs.
Okay.
And we've
Hmm.
also got sensory or physical difficulties. Now, from what I understand, currently, in Pakistan, you've got
No, in Bangladesh, yeah.
or in Bangladesh, you've
Yes.
got you've got mental, physical, behavioral, and
Yes.
emotional disabilities,
Yes. 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 Yes.
and visual and hearing impairments. I think that's similar
Yes.
in Bangladesh,
Yes.
and in other areas. And the new kind of policy, I think the government is looking at bringing that into kind of mild, moderate, severe, and profound difficulties. So
Yes.
they're
Yes.
looking at kind of relabeling and recategorizing the different needs to
Mm.
ensure that they're more kind of they're clearer really in terms of children's special needs.
Okay. Um, what do we do if your child is struggling in school? Like, how do we find out, like, you know, this child is having difficulty in learning? And I mean, what do we do with them? What are the next step to take, you know,
Yeah, I think
as a
it's
parent?
yeah, as a parent, it's always very worrying for parents when they find that their
Yes.
children are not, doing as well as they would like. And I think, in parents can go through very different emotions. Some
Yes.
parents will kind of, realize that actually my child needs support, and I need to kind
Yes.
of, kind of galvanize and make sure that
Mm-hmm.
I get that support. For other parents, it takes them more time because they may be in denial. They may find it difficult to accept that
Mm-hmm.
their child needs help. So parents are very much kind of can be very at different stages, and depending on where you are as a parent,
Mm-hmm.
it will kind of determine what you need to do. So and certainly from what I understand in Bangladesh, there's a lot of stigma sometimes associated
Yes.
with special needs. So accepting that your child has got special needs
Yes.
can be
That is a big challenge.
a
Yeah,
very
that's
big,
a huge,
very big challenge.
yeah,
So
big
for some
challenge.
parents,
Yeah.
it'll take them a long time before they even
Mm.
seek out support because
Mm.
in their mind they're not accepting that their child needs support.
Yes, yes.
But once we've got past the kind of the difficulty in accepting your child's needs, the first step really is to go and speak to your school, to your child's school, and to
Mm.
try and find out from the school, kind of what their views are, and whether your views and their views are
Mm-hmm.
the same. So,
They are the
is the
same or
child
not.
experiencing difficulties, and if so, what are the schools doing to meet those difficulties?
Mm-hmm.
What have they put in place? So, a conversation
Exactly.
with a school is always a really, really good starting point. Speak to your child's school, find out what they're doing, and find out whether there are any things you can do within the home situation to support your child. And that can only come through those conversations.
I have one question, like regarding. I'll talk about our country views also. Like for
Yeah.
example, in UK, if a child is actually, I mean, if a parents finds out that the child is struggling with studies and a lot of other difficulties, what do they do with them? Like, do they give them to a special school or do they stay? I mean, they can study with the normal child. Like, is there any special education for them within the school?
Yeah, I think again that's where different countries vary, and again,
Yes,
just from the
yes,
reading I've been doing, it's clear that in Bangladesh, you're at very kind of different stages. So, over here in the UK, we talk about inclusive education. We
yes,
think that it's really important that when children have got special educational needs, it's important that they're educated alongside their mainstream, with alongside other children who don't have
yes,
those difficulties. So we
yes,
really
yes.
believe that, we don't believe in kind of segregating and keeping
Right,
children
right,
separate. Yeah,
right,
we
right.
think that all children benefit from children with special needs being included within
Yeah, children are children. I mean,
children.
some needs a special attention and some needs a normal.
Yeah.
So, but in our country, we have seen most of the school, there is a special school for us, as far as I know. There's a special school for this kind of child. So, and some of the school, they call their parents and they talk to them that we can't keep your child in our school because we have some other child also, and it's difficult for them to.
Well,
Hello?
yeah,
Yeah.
I think it's
Mm.
really hard because I suppose
Yes.
for me, when I think about diversity and inclusion, and that
Yes.
working within that space, it's important that we prepare children for when they grow up. So it's about
Right.
preparing them for dealing with all kinds of
Yes.
differences.
That is
And
that is
you know,
very good.
you know,
Yeah.
and in a sense, if we separate children, at the
Mm.
early stages and say, well, we'll put you in that school because
You
you're
don't
different,
belong to this
in that
world.
school
Yeah,
you don't
that's
belong.
yeah.
It kind of sets up really kind of difficult messages, and it
Right.
doesn't help children, when they become adults, to embrace, kind of, diversity and inclusion. So I think it's really important, wherever possible, that children who've got special needs, that they're educated alongside their, mainstream and, peers. But
Mm.
of course, it goes without saying that if the child's needs are so severe that they
Mm.
require specialist provision, and that specialist
Mm.
provision is not available from your normal school, kind of mainstream schools, then of
Mm.
course sometimes it makes sense for children to be in specialist schools where those needs can be met. But
Mm.
my first step always is, let's try inclusive education wherever possible and make sure that we support those children alongside, their peers.
Yes, yes, right. So, since I mean, you're a psychologist, so you can tell me a little bit about the psychological changes it goes to parents' mind when they find out. Like, what are I mean, what are the challenges that, I mean, what do they think about it?
Well, I think,
What are the,
yeah, it's really difficult for parents. I think for
mm,
any parent, your
mm,
child is very dear, and and you want your child to do well, and
Yes.
and so often for parents with children with special needs, it can come as a shock, in terms of kind of
Yeah.
when those needs are
Right.
first identified. And as I said before, that different parents will go through different stages, and for some
Hmm.
parents, they will they'll find it very difficult to accept that their child is different, and they will want, there'll be almost like a loss and grief stage where
Hmm. Hmm.
they find it difficult to come to terms with with their child's needs. um, and so I would say, with professionals, it's really important that we understand that the journey for parents,
Hmm. Hmm. Hmm.
parents with children with special needs, can be very difficult, and
Very
is very
difficult.
different. And it's important that we support parents on that journey, and that we don't judge parents for how they may respond in those early stages. um,
Right.
and so I think, the psychological reactions can be the kind of the fear of stigma, that
Right.
you're worried that, other people will look at you and they'll judge you, and they'll
Hmm.
judge
Hmm.
your child, and they'll ostracize you and not accept you because of your
Yes.
child's needs. And for others, they will wish that, they had a child who was, in quotes, normal.
Hmm. Hmm.
They'll
Hmm.
wish
Hmm.
that, that things were not so difficult, and there can be a bit of rejection which can happen in terms of rejecting your
Right.
child.
Yes.
um and and for others, they will, for us, for the vast majority of parents, they will very quickly embrace the fact that actually, there's nothing wrong with my child. All my child needs is the right support to
Yeah, exactly.
enable them
And
to do well.
socially accepted by everyone, this that is
Absolutely.
very important. We need to
Absolutely.
support them also. That is also, I mean,
Yeah.
the surroundings,
So important.
neighbors, friends. I mean, as long as we support them, I think it will be okay for them to overcome these difficulties. Okay,
And
my next question. Yeah.
I think that's why it's so difficult currently with the pandemic, that for a
Yes.
lot of parents, the
Yes.
support which they had in terms of
Hmm.
those networks of support, and those are not readily available to them.
Yeah.
So,
Yes, that's true.
it's really important that we acknowledge that currently the pandemic is difficult for everybody. The
Hmm.
COVID-19
Hmm.
is
Hmm.
very hard, but it's
Hmm.
even more difficult for those
For the
parents with
parents.
special needs.
Because they're not going to schools, and plus I don't know
Absolutely.
about UK, but for I spoke to some other school also, it's difficult for them to sit in front of the computer and explain them to do. So what they did, they've given all the information to the parents, and they told the parents to take care and to teach them, and to, because it's really difficult for them to sit in front of the computer for
Absolutely.
2 3 hours. So
Well,
think about the parents who have gone through this whole pandemic.
I think,
I
it's a
mean,
challenge. It's a challenge
it's a
for
big
all
challenge for
parents in
them.
terms of, supporting children at home
Yes.
in the lockdown.
Yes.
But it's even, it's 100 times
Even
more
more
difficult
hard.
if you've got a
Exactly.
child with special needs. Yeah.
Yes, yes. Okay, so my next question was really, how can I keep my children focused and engaged and enjoying learning at home?
Yeah, and yeah. So I think, the main thing is really, around, kind of making sure that, we find the right ways of communicating,
Mhm.
with our children. And I think communication is really, really key, and it's important as parents that we're able to set aside that kind of that time and quality time to spend with our children and to communicate with them. um and and I think, it's really important that in looking at how we support our children to focus and concentrate, that we try and engage them in the areas which they're most interested in. So learning about what it is your child enjoys,
Mhm.
what their interests are, and making sure that we use, things like positive praise and, and incentives to encourage
Mhm.
them to concentrate and focus. um, and really kind of making sure that we, our communication with our children is, primarily, kind of, positive, and that we're not focusing on the things they can't do, but we're focusing on the things they can do. So
Exactly. I
yeah.
have maybe like brushing your teeth, doing your bed. I think the parents should encourage them to do more housework, since they're at home, right?
Yeah, no, absolutely. No, I think we talk about, in special education, we talk about, kind of identifying not only the child's needs, but also
Okay.
thinking about, what are the outcomes we want the children to achieve.
Yes. Yes.
So depending on the difficulties your child is experiencing, it's really important to look at, what is it that I want my child to be able to do, in a
Mm-hmm.
6 months' time, in a year's time. So things like, for children who find it difficult with, kind of independent skills, like, kind of, brushing your teeth, getting yourself dressed, it's really important to identify those positive outcomes in terms of what we want them to do. And then as a parent to think about, okay, so what support and what help can I put in place to
Mm-hmm.
help my child to achieve that? So if we're looking at kind of supporting your child with, kind of, dressing in the mornings, you can kind of think about, how can we actually, what can I do as a parent to support them with that outcome?
Yes, exactly. It's actually depends on the parents what they want the outcome from the
Yeah,
child.
absolutely, absolutely. And
Uh,
making sure that we break those outcomes down into small steps. So let's not go for massive outcomes. Let's kind of start with
yes, yes,
small
step by
steps,
step. Yeah,
step by step. Yeah, yeah.
yeah. Okay, Dr. Hilda, I have one question. Like, what are the early signs? What are the signs of like how will you find out? Is there any signs that they will show, and what age?
So is there any signs that say, repeat that again for me? Is
Is
there any
is there is there any early signs that they're finding it difficult? Like, how will the parents find out?
Yeah, I mean, I think, most
And what
parents,
age? Yeah.
yeah, in the UK, we talk about special needs kind of starting from the age as early as the age of 2, you know.
Mm. Okay.
So,
Okay.
it's, we really kind of, from those early developmental checks, which are done by health visitors and pediatricians, where parents usually, I think that a lot of parents, parents usually, you know, um, recognize the difficulties, even earlier than that, that a parent will usually kind of,
Mm.
parents who I work with will usually sort of talk about, um, they'll compare their child and they'll say, well, actually, I was able to see from an early stage that my child was not talking as well as other children, or that my child was not able to walk, that they learned to walk much later than others, or
Yes.
that, my child found it difficult, dealing with frustration. So if something happened, they would have, find it difficult coping with that, and they would cry and throw themselves on the floor
I
or
think the
whatever.
parents will find out. Yeah,
So parents will
I'm
find
sure.
out. So parents,
Yeah,
parents see those signs very early on,
very
um,
early
and,
on.
that will depend from child to child. They're depending on the child's special needs.
Hmm.
There'll be different signs along the way.
Okay, okay, okay. I'll just move on to my next question. Why is early intervention and special needs education important?
Yeah, I mean, early intervention is, honestly, I can't stress how important that is. It's, and sometimes people talk about early warning systems. It's
Yes.
important that we identify children's needs at a very kind of early stage, because it's only by identifying the needs early and being able to, um, kind of work out what support needs to be put in. It's only by doing that that we can kind of put in the appropriate intervention and strategies early enough. And when we do that, when we identify needs early and intervene early, it actually enables us to stop those difficulties, kind of getting, more severe, and sometimes, to prevent them getting worse in the long run. um
Hmm.
and sometimes I find that, when parents, referred to me when the child is, kind of about to enter secondary school, or, when they're kind of, say, age 11, some of the things we could have put in place when they were
Yeah.
younger,
Yes. Yes.
you've missed that stage, and it makes
Hmm.
it very hard for the child to then have positive outcomes. So
Hmm.
the importance of identifying needs early, responding early, and putting in the strategies early, both in school and at home,
It
cannot
will
be.
help the.
Yeah,
It will help the child to grow, I
absolutely,
mean,
absolutely.
differently.
Yeah.
Uh, okay. What does the special education evaluation process involve, and how can you contribute to it actually?
Okay, so that it again, it depends where you are, you
On
know,
country to country, yes.
countries, yeah, from country to country. So in the United Kingdom, we've got, you know, what we call the Special Educational Needs and Disability process,
Mm,
which basically means that we divide that up into kind of the non-statutory process and the
mm,
statutory
mm,
process. So the non-statutory is where you are expecting schools to try various things first before requesting additional resources and support from the local authority. So there are really
mm,
kind of clear expectations in terms of, you know, what we expect schools to do for children with learning difficulties. So if a child has got a reading difficulties, the school will have to put in place, you know, specific strategies to support that child to make progress. And it's only when the school have done that that they can then request additional support from the government or from the local authority.
mm.
So, and from what I understand, I think in Bangladesh, you have a kind of multi-agency approach, so that if a child has got
Yeah, yeah.
difficulties, there'll be a group of professionals who will work with that child to identify
Yes.
their needs.
Yeah,
Now,
I
our multi-agency approach starts later, so it's only after the school have tried different things first that you would then refer them. The child would then be referred for what we call an education, health, and care needs assessment. Um, and then that's where we really get that multi-agency process working.
Mhm.
I mean, actually, that's not entirely true. I mean, we have multi-agency working for children who don't have, when you haven't started the statutory process, but
Mhm.
but certainly it's much more robust when we're looking at the statutory framework and statutory needs. Yeah.
Okay.
So
Uh,
I think, the evaluation process, from what I understand, it's very much about kind of, speaking to your schools, working with the school first, and then contributing, you know, um, and sharing with the school, what your knowledge of your child is. So, supporting the school to better understand your child's needs.
so evaluation starts from school, you're saying, I mean, I mean,
Yes,
it's better if you
absolutely.
can communicate with the school.
Oh, yes. The
Okay.
first steps always, I would say, where a parent is concerned about their child is, go to your school, speak to the teacher, get a sense of what is the school doing to address these difficulties. Do the school
Yes.
share the concerns you have? And
Yes.
and if not, then why not? And and
Yeah.
have a conversation with the school. And
Right.
then, once you've tried that and worked with the school to try and support your child's needs, the next
Hmm.
step would be for the school to refer your child to specialist professionals. And that can
Okay.
include either the educational psychologist, the speech and language therapist,
Hmm.
the physical and disabilities teams, depending on what your child's needs are,
What your child
different
needs
professionals
exactly.
will be
Yeah.
required. Yeah.
Okay. Okay. This is okay. How can special education can support? It's okay. I think it's almost you've already answered the question I've asked earlier. So actually, how do you support your child's mental health needs? This is really important.
Yeah,
How would you do that? Yeah.
it's so important, especially during this current time. I think children need to feel
Mm.
safe and secure. They need to know that that their kind of their needs will be taken care of. And it's so important that we don't underestimate the importance of the child's emotional, that they're kind of their social, emotional, and mental health needs.
Okay.
um and I think that there are lots of things that parents can do, and and it really starts with kind of making that space and time and quality time for your child. So being available to listen to your child's concerns and worries, being able to um offer support and reassurance if your child is worried. So currently,
Yeah.
the example I'm
I
thinking of.
mean, yeah. Yeah, yeah,
with
you
the
can go on with
pandemic,
the example.
with
Mm.
with the current pandemic, some children will be worried about, kind of, they'll be, they're suddenly seeing, different behaviors. People are wearing masks, people are,
Yes, yes.
all this kind of social distancing. It's like, it just doesn't make sense. So, providing that support and explaining things to your
Mm.
child in a way that they can understand what's going on, and reassuring them, so that they understand that actually, things will get better, that
Yes.
this is, this, that they've got the skills and the support to work on some of the challenges, and that they can work
Mm-hmm.
together with their parents is really key. And we often talk, as psychologists, about resilience. So it's really
Yes.
important that as parents we support, our children to build that resilience, and that really starts by supporting them to, kind of talk about their emotions, to talk about their feelings, and to identify when they're not feeling safe and when they're not feeling secure.
Right, right. It's really important to feel what they want. And I mean, whatever you said, I think even I have a child, so I mean, everyone, I mean, it's the same thing for all the childs. It's really hard for them to make them understand what's going on around the world.
It's so
The
difficult.
ma So, and the special child is also more difficult. Yeah,
Yeah,
definitely.
yeah, absolutely. And I do think that, supporting children to talk about their feelings and emotions, and to talk about what worries them, what's scaring them, to talk about when they're feeling happy, and how, how when they're happy. As a parent,
Yeah,
it's really
yeah.
important to
To give
build that
importance.
language,
Yeah.
to give a language
Yeah,
to feelings
exactly.
and
Right, right,
emotions.
right. Yes, they
Yeah.
have a special language. So you try to understand their language, their emotions, and their feelings, and giving importance to that. That is very
Yeah,
important for every
absolutely.
child, I think. Yes.
And and
Yeah.
making sure that, if a child, is having difficulties and they're feeling
Yes.
upset, that, the first thing is always, you reassure them, you offer them that comfort. But afterwards, you find some time to reflect with your child on
Yes.
some of those difficulties. So you get them to talk about, some of those difficulties. And we sometimes talk about social stories, where you kind of write, stories related to your child's interests, and you can
Mm-hmm.
kind of read some of those stories and help them to explore their feelings and emotions, in a way that they can understand.
Understand exactly. I mean, what they like, giving
Yeah,
importance of what they're actually inclined to. Okay,
yeah.
my next question would be, yeah,
So I've just got
like
one
now
more
now
thing to say.
nowadays, like I have one, like I spoke to one of the Indian psychologists, one child psychologist. She told me about some art theory, like art therapy
Therapy,
for a
yes.
special child. Yeah, this really works, I think. Yeah, for a special child, you think this?
Yes, I think art therapy has got it's a very important, therapeutic tool for children with special needs. I mean, I think anything which can help children to express themselves and
Mm-hmm.
to explore their emotions is really important. So for some children with special needs, they're not able to verbally communicate and talk about things, so they need
Mm-hmm.
other ways of communicating. And things like
Yes.
art therapy, it provides that kind of that vehicle and that tool to support children to express what they're thinking and what they're feeling. um,
Mm-hmm.
and so yeah, it can be a very important tool. And you also have things like music therapy.
Yes. Yes.
And you've got lots of different therapeutic tools which
Mm.
can be used. Yeah. But I think as
Okay.
parents, it is about kind of just making that space during the day to engage
Yes.
your children. And it's really hard. And I know as a parent myself that
Yeah. Yeah.
sometimes when you've got, 101 things to do, to have that 10 minutes when you can sit with your child and engage in an activity, it's sometimes,
That is very true.
and
It
that
it
often,
it helps. It helps.
it really helps. And that,
I've noticed that. Yeah, I've noticed that
yeah,
with my child. Yeah.
it really helps. And I think that
Yeah.
sometimes, and as parents, sometimes we can look for easy solutions. And that's not to say
Mm-hmm.
that, parents are not doing what they should be, but sometimes,
Mm-hmm.
we can think, actually, if I just put my child in front of the TV for 10 minutes, it allows me to do this. But then that 10 minutes turns into an hour, and you end up, with children who spend most of their time on screens and are not
Screens,
getting
yes.
that positive interaction.
Especially in pandemic, a lot
Yeah,
of
and
screen
especially in the
time.
pandemic. So
Yeah,
I
a lot
think,
of screen time.
as parents, wherever we can find that time to really kind of sit with our children, engage in things like drawing a picture, doing some art, reading a storybook, the more time we can spend with our children doing that, the better.
No, the better. Yeah, that's true. My next question is how to create a safe and secure environment for your child.
Yes, I
Mm.
think it really, it's about, first and foremost, understanding what your child's needs are. So for different children will need different things in terms of safety. But I think for all children need to feel safe and secure. They need to know that, that their parents, first and foremost, will be there for them, that they'll be able to, take care of them. And that's
Mm.
why it's really important that, that language of reassurance, and that parents are able to communicate not only verbally but with non-verbally, through things like, giving your child a hug, kind of, your non-verbal communication is as important as the words we use as parents. um,
Mm-hmm.
and I think that, different children will need different things in terms of, that kind of feeling safe and secure. And it's very much about understanding what your child's needs are first and foremost, and then putting in place what it is they require. um you've got children. For some children, we've got, say, things like autism. They need the parent to be there, 100% of the time, to ensure that they don't engage in anything which is going to be dangerous. So making sure that the environment around you is safe is really key. um and as a parent, a lot of parents, who have children with autism, understand that actually, we need to ensure that the environment is safe and secure, and they'll make sure that they change the environment to
Mm.
support that.
Okay. I think we're almost about time, but I have two more questions. What are social or like what are some of the social and emotional skills and how to support your child, Like you can
Yeah.
suggest some of the
Yeah, I mean, social emotion skills. I mean, different children will have different challenges with regards to social and emotional skills. You'll find that there's some children who, find it really difficult um, kind of engage in play with their, with their friends, and they'll find it difficult to, to join in play. For some children, they'll become very easily frustrated if something goes wrong. So they need adults to kind of interpret and support them in the language of play. um and I think it's really important that when we're talking about social and emotional health, that as parents we understand, what that means for our children. um
yeah.
and that we understand that emotional well-being is as important as learning the skills of reading and writing.
Yes.
Sometimes I think parents um, can dismiss, uh, you know, um, and forget that the child's emotional well-being is really kind of key.
Hmm.
And so things like, as I was talking about before, checking out, how your child is feeling, making sure that you give time to talk to your child and understand what they're going through, um, is as important as making sure that you support them with their reading and writing.
Okay, Dr. Hilda, I have last question is like, you like to say something to our viewers regarding the pandemic, like since like a lot of people are going through a lot of stress, depressions, and a lot of things happen. So, is there anything that you would like to, in general, like, is there
Yeah,
any message you would like to give?
I think that the message has to be one of of hope and that things will get better. I think currently the pandemic is affecting us all. It's a really, really difficult time, as I said at the beginning, for parents who've got children with special needs. You know,
mm,
the challenges in terms of
mm,
supporting children, at home, are even,
mm.
have been made even more difficult during the
More difficult.
pandemic. So I think the message for parents is, first and foremost, you know, take time for yourself, look after yourself, because it's only if you look after yourself first that you can then look after your children.
Yes,
So,
yes.
I think, it's important that within a family you have a routine and structure, and just because the children are not going to school doesn't mean that you don't have a routine. So I'd say within that routine and structure, make
You
sure that you've got
maintain.
some time for yourself, and
Yes.
which allows you to take a breath. I'm very in I believe very strongly in things like relaxation and meditation. So, doing some breathing exercises, I think, we refer to it as, kind of belly breathing, with children, kind of making sure that we support children to engage in activities where they can sit still and just breathe and relax, and as a parent, being able to take time for yourself to do that is just as important. But my messages, for parents, are very much about, looking after yourself first, making space for your family and for your children, um and and really kind of seeking out those kind of support networks. Just because
Mm.
we're not able to physically meet with people, we can still
Yes.
find ways of speaking to people on the phone, making sure that
Video.
we're
Yeah.
still kind of keeping in touch with our support networks to get that support we need as parents.
Okay. Thank you so much for your time. It was really nice meeting you through
Yes, thank
online.
you. Thank you for having me.
And
It's been
there,
it's and
there,
I've been
there's so much information you've given us, and I would like to do one more program with you. I mean, the thing is, it's regarding this same topic, but I will get someone from our country so that we can discuss our context, like how we are dealing with special needs education, and you can talk about.
absolutely.
I think that would be really good if we can compare and if we can see what are the trainings we are going through.
Yeah, and I think,
It would be a good idea. Yeah.
I think that would be a really good idea. And I think on that,
Yeah.
we can focus much more in terms of the different needs children have. So we can talk about children
Yes.
with autism and think about the different strategies which,
Strategies.
parents can
Yes.
use. And we can talk about children with Down syndrome or
Sure.
physical disabilities. So there's more scope for thinking about those specifics in
Because
kind of
every
for
country has special, I think every country is different, the
well
way they're like,
the
especially the special needs, because the rules are different, everything would be different. So that's why I need to know, actually. I mean, you can also ask them question, what are the training that they're going to, what are the technique they're using.
yeah,
So I think it
absolutely.
would be a good idea. Yeah, it would be
I
a
think
very good idea.
I think you're right that every country is different and there are different
Mm,
expectations in terms of
mm,
what schools do and so forth. And it's important for parents to know what the different processes are in terms of special needs within their own country, because different countries have different processes. And so meeting with someone, with a psychologist or a professional, in Bangladesh, would be really useful to try and
mm.
compare those differences, and because it then
Yes.
enables us to advise parents in a
Right, right,
in
right,
a
right.
clearer way, which is much more specific to their
Mm-hmm.
to their setting.
Yeah, that is very true. Okay,
Yeah,
so I'll schedule with you. That's not a problem since this is a foundation, Pratiddhani Foundation. We are dealing with a lot of awareness, and we are doing a live show from the beginning of this pandemic. We're giving awareness. We're doing a lot of awareness program, and we have online consultation also. And this mental, we have also we try to do at least one mental related program because people are going through a lot of mental stress nowadays.
I
So
mean,
mental stress has no boundaries. Yeah. So
absolutely. And it
yeah.
sounds like, Sanjida, you're doing some, some amazing work. I mean, I think,
Thank you. Thank you.
charities and organizations like yours
Yes.
are really, really important in ensuring that that support and is available for parents, and that we give them that, those skills and
Yes.
understanding of their children's needs.
Mm.
So, I commend you for, for the work you're doing, because it's really,
Thank
really
you. Thank you
important.
so much. Thank you so
Yeah.
much. Okay, so I'd just like to say something to the viewers. Thank you, whoever has watched our program, and we got a lot of useful information through Dr. Hilda. I'd like to end this program, and next time you keep an eye on Pratiddhani Foundation for our next topic. Although every special needs child is different and every family is unique, there are some common concerns that link parents. These include getting appropriate care, promoting acceptance in the extended family, school, and community. For some, planning for an uncertain future may be necessary. You will also find yourself adjusting routine, expectation, sometimes quite often. Out of necessity, parents of children with special needs are often more flexible, compassionate, stubborn, and resilient than other parents. While it may not be something you had hoped for or expected, it is important for your child that you try to do your best. You can take comfort in the fact that you're not alone. So feel comfortable reaching out for support. Thank you so much for watching us. Thank you, Dr. Hilda.
Thank you. Thank
Thank you
you.
so much.